All right, everybody, it's my pleasure to introduce Dr. Tam Nguyen, who is our next speaker today. Dr. Tam Nguyen is a clinical psychologist and serves as the executive of ambulatory mental health and addiction care for Sutter Health, a not-for-profit healthcare system providing comprehensive care throughout California. Dr. Nguyen is an expert in developing, implementing, and running large-scale mental health care projects. She is passionate about identifying needs within communities and creating innovative services such as digital mental health programs. She has extensive experience managing integrated mental health care and community-directed programs in both the outpatient and clinical settings, as well as community outreach and preventative services. Please join me in welcoming Dr. Tam Nguyen.
Thank you. Can everyone hear me? Great, thanks. And thank you for that kind introduction, and thank you for the invitation to be here with all of you today. As shared, I'm a clinical psychologist by training and currently at Sutter Health working to really think about how we can ensure access to mental health and addiction care services to all of the patients within our communities and to really continue to provide the highest quality care. So just speaking a little bit about Sutter Health, it is a not-for-profit community healthcare system based out in Northern California. We serve over 3.5 million patients across Northern California and have clinics ranging from Sacramento all the way down to Santa Barbara, providing comprehensive healthcare in addition to mental health care services, hospital and outpatient clinic services as well. And one of the things that I'm really proud of in terms of being a Sutter employee is its commitment to mental health care services. At Sutter, we really view mental health as human health and really have in the last year and a half focused around what is our strategy for mental health services across Sutter. And we really have identified 4 primary areas in which we want to really step into our approach related to mental health and addiction care. As you can see here, we're focused around expanding digital and telehealth services to all of our patients and our communities. We really strive for clinical excellence and share what we learn to advance the care within our communities and to others. We're committed to continuous improvement and ongoing evolution. We also want to continue to listen to our community and invest in really in solutions that make sense for them. Many of the panelists earlier spoke around that, right? Like how do we ensure that what we're doing within our systems works for the people that we want to help and support. And lastly, I think a shared commitment in this room and in this space amongst all of us is to eliminate and or reduce mental health stigma and really normalize the need for mental health care services and access for all. So today, really we're going to be talking about the public health crisis around youth suicide. We'll talk a little bit about an evidence-based intervention called Caring Contacts and how we at Sutter Health are implementing this intervention to support the reduction in youth suicide. So you've heard this by many of our presenters today already. The challenge that faces all of us today is really youth suicide is a public health crisis, right? We know that really it's the second leading cause of death among youth ages 15 to 29 years old, and that there is a disproportionate risk that face LGBTQ plus youth. We also know that follow-up care works, and we also know, though, that many don't follow up and attend those follow-up care. And so our solution here at Sutter is to implement an evidence-based intervention called Caring Contacts. It was developed in the early 1960s, and at the time, it was really sending postcards or letters to patients after a discharge from an ED or hospitalization stay. And it was on different time cadences, monthly, every 6 months, at a year, just to remind the individual of the services that are available to them within their clinicians or within their health systems. And so what we've done here at Sutter is adapt this intervention so that rather than sending it via a letter or a mail, for it to be sent via text message. And so as you can see, our goal is to be able to send these caring text messages not only to the youth, but also to their caregiver. So this component of our intervention is unique to the Caring Contacts intervention. And as you can see here, there are 19 touch points across the year in which we want to implement or deliver these caring messages to youth and their caregiver with their consent. And this is a video that I want to show just to speak a little bit about caring contacts. It's going to show Kevin Hines, who is an advocate for suicide prevention. And many of you may be familiar with him. At 19, he attempted suicide by jumping off the Golden Gate Bridge and survived. And in this video he talks about the impact that caring contacts have for him.
The CDC, for example, now recommends caring contacts. And healthcare professionals all across the country are also sending out colorful postcards with positive messages to those at risk for suicide.
Remember Kevin Hines?
The caring letters that Jerry Mono created.
Well, he now travels the country talking about suicide prevention and the role of caring letters. He knows firsthand of their power because he got one himself.
It wasn't about my mental illness. It was telling me that I'm a good person and that I matter.
How can that have that big a difference? That big an impact?
Oh my God. Showing you care about someone, not saying it, showing it is tangible. When it's tangible, it means more. So, the one thing we know that does work, we better be using it.
So this is an example of what a text message for a youth might look like first day after discharge. And I also wanted to acknowledge that prior to implementing this intervention, we consulted with a number of healthcare systems across California, across the country, have implemented caring contacts. And they were kind enough to share with us some of their messages that they had already created, along with a youth advisory board. And we are in the process of updating those, but wanted to share an example of what these messages could look like. So for example, it might say, "Hi, Tam, just getting through the day can be its own kind of strength. You're doing it." And many of you may be familiar when implementing digital solutions such as text messages. We are also asked to send a similar message just to remind individuals that we can't respond to the text messages, and that certain text messaging charges apply, and that also we want to offer some resources for them that they could use if they are struggling. So what you see in that second text message box are routine messages that the individual will receive with every message cadence, just reminding them of the national crisis response or lifeline resources that are available to them, including 988 and 741-741. This is another example of another text message or a caring contacts message that a youth may receive. This one is on day 29. So it'll say, "Hi, Tam. Healing can feel up and down sometimes. That doesn't mean you're doing it wrong. Your pace still means progress." And similarly, what I didn't mention earlier is we also, in some of the messages, have corresponding images that will be paired with these messages. So here's an example of one of those images, and it sort of aligns with what the message says. So here it says, "Growth is not linear." This is an example of a text message that a youth will receive on their birthday. So, "Happy birthday, Tam. So glad you're here. You bring something good to the world." And you'll notice a little heart emoji and then a corresponding image that comes with that birthday message of "You're worth celebrating." This is an example of a text or a caring contact text message to a caregiver or loved one, a parent of the youth, with the youth's consent. So, "Hi, this is a note from Sutter Health. We're sending a series of supportive messages to Tam over the next year. You're receiving this because you're an important part of their care. It's normal to feel unsure, overwhelmed, or even scared after a mental health crisis. You don't need to have all the answers. Just being present can make a difference." Similarly, they'll also receive information on resources. If you ever need someone to talk to, you can call 988 or text 741-741. We're here to support your role too. You're not alone in this. and reply stop at any time if you prefer not to receive these messages. And so one of the things that we did make very intentional was at any point in time, the individual, whether it was the youth and or their caregiver, could opt out of continuing to receive these messages over the course of the year. I should also mention that the caregiver or parent messages are less in cadence than they are for the youth. The youth will receive 19 messages over the course of 1 year, starting at the time of enrollment into the Caring Contacts program, and the parents will receive 9 messages over the course of the year. This is another example of a message to a parent and our caregiver on day 150. It's easy to miss the quiet signs of healing, like a small laugh or a conversation that didn't shut down. These moments matter more than they might seem. So what's our goal for implementing Caring Contacts? We're committed to zero suicide, and that's our goal, moving towards 2030. We also really want to improve the patient experience and their support post-discharge from a hospitalization or a ED visit. And we really do want to hear from our patients and know that the way that we're connecting with them, the way that we're supporting them, feels like it works for them. In terms of our implementation timeline, what you see here is what we've been doing to really plan for the implementation of Caring Contacts. We've really just finished this next stage of our work around improving or adopting the Caring Contact messages. So I'll speak a little bit about what we've been doing to do that. One is in terms of the message co-design and D-Scout, we've been using a research platform called D-Scout, where we recruited participants across 3 different age groups, as you can see here, with a total of 269 youth participants that responded to this research platform. We essentially had each of the Caring Contact messages, 19 of them, the corresponding images, and asked the youth participants to respond on a Likert scale from 1 to 5, how much that message resonated with them. And then they also had an opportunity to give us any general statements or feedback around those messages and images. And we recruited from across the country. So the map shows you the number of participants from each state across the U.S., and there are a number of states in which we didn't have any participants. This shows you the results of our D-Scout research review or study. This is a top box and bottom box graph, and all the ones that have a sort of large oval shows the Caring Contact messages that really resonated with our youth. So you can see that was on day 36, day 50, 110, and on their birthday. Those messages, the youth and the participants really liked them. They thought they were great. And then there were others, including messages on day 29, day 170, 200, and so on, that didn't resonate as well with the youth, and they gave us some really focused feedback on ways to improve that. Additionally, just last week, a couple of folks in our team did a focus group with the Sacramento LGBTQ plus community center focus group. There we had 6 youth participants. There was 1 male, 5 females, ages actually between 16 to 26, who gave also sort of general feedback around the messages as well as the images to our team. And here's a summary of some of the feedback that the youth and the focus group provided to our teams. They liked, for the most part, the emojis. They liked the messages that really validated the time it takes to heal. And they really liked the birthday message and how it was personalized, the hello, Tam, or really somehow making it individualized to them and indicating that. Things that they suggested could be improved spoke really around some of the images looking a little bit like they were AI generated, so speaking about technology and some of the tools that we have access to today, and just times in which it felt not as authentic or genuine. So this is a word cloud that summarizes the results both from our D-Scout Research Qualitative Platform Study as well as our focus group. The words that are in bigger size font indicate, just sort of more youth, sort of giving the same feedback. But as you can see, there is an overwhelming response saying make it personal or peer, personal or individual. Present tense, help it feel genuine and authentic. Indicate that growth is not linear and that it's different for every person. Use names to individualize the messages. And then in terms of the images, they liked it when they were more calming, they were bright, they were clean. It didn't seem like it was AI generated, so images where it looked like someone drew it themselves. The birthday card, the reflection that one of the youth shared was, it looks like a birthday card my grandma might have sent to me when I was growing up, and so it gave them a sort of positive association with that birthday card image. So I'll pause there. I was rushing through the end because I know we had a couple of minutes left, but open for questions.
Thanks very much for the presentation. I just had a look at the D-Scout platform, and it seems like quite, well, at least on the face of it, a cost-effective way of engaging young people. I'm interested in how you chose this as a way of involving young people and how you weighed up the pros and cons of, say, having a youth advisory panel with continuous engagement along the line. Yeah, can you talk us through the kind of different levels at which young people are involved in the testing and co-design, and then also, if you wouldn't mind sharing, how much it costs and how long it takes?
Yeah, great question. Thanks for that. I think in the service of any intervention, at my core, I always think there's always room for improvement, and there's a time when you got to go with what you got, put it out there, and see how it connects with what you're trying to do. So when we first received the messages, as I shared, they were shared with us from 2 health systems that had already implemented this with their youth population. And we used that as the baseline messages. In their delivery of caring contacts, they did not have images. No, they did have images and messages. They didn't have the caregiver component. But we thought, okay, that was a few years ago. Let's now connect with our youth and say, do these messages that was created a few years ago with the Youth Advisory Board still resonate with you all today? And if not, what kind of changes might we need to be able to do? We also recognize we need to do it quickly. Otherwise, it might be yesterday's fashion already, right? That's how quick these things can move sometimes. D-Scout is actually a research platform that Sutter we've used as part of our design and innovation team. We have a design and innovation team across Sutter, and one of the tools that we developed was actually Scout by Sutter Health, which is a resiliency app for youth ages 13 to 26. And so it was a resource that was already available to us, 1. 2, it allowed us actually to connect to youth across the country really quickly. Right? We could set up the research study in a day and have it send out, and they had thousands of youth that are part of this research platform that, based on their response to screening criteria, could then be enrolled into the study and give us immediate feedback. I think it was within 2 weeks we had received those 269 responses across those different age ranges. The other piece is that I think it was a $15 gift card for each participant who participated in the D-Scout study, and similarly, same for our focus groups, is we also did offer a $15 gift card.
Hi there, my name is Monica Lind. I really enjoyed your presentation. I have a question about how the text messages, partly how they landed, but more, so I got a 2-parter for you, forgive me. My first question is, did people ever respond even though you told them not to? And then obviously you directed people to 988 or to crisis text line or at 741. Do you have any idea if people used those services prompted by your messages?
Those are great questions, and we don't know yet. We are set to go live with our Caring Contacts program in January of 2026. We do have, if a patient responds, a pop-up message that reminds them that we don't regularly see these messages, and if they are in a mental health crisis, a reminder of what those resources are available to them or to connect to their healthcare provider. At the end of their participation, there is a survey asking the participants of their experience with it, both for the youth as well as their caregiver. One of the things that we've grappled with as a team around this is, should it be bidirectional? Now, originally it was not, as you all know. It was a letter or a postcard, right? And so the intent is similar with these text messages. But should it be? And should it be connected to a crisis support line within Sutter or more nationally, and or both? And those are things we likely will move towards in the future implementation of Caring Contacts. But I think those are great questions to say, to what extent is this reminder of these resources being utilized? And would that be a way for us to say, here's how we're really connecting with our youth in the population and getting them connected sooner to these resources and potentially really changing the course of what might happen for them.
All right. Well, unfortunately, we don't have time for more questions right now. I see hands going up, so please grab Tam at the break. But please join me in thanking Tam so much. We'll take a 10-minute coffee break before our fourth panel.
Yeah. I also just wanted to acknowledge the team. While I have the privilege of sharing the work that we're doing here at Sutter with all of you, it really takes a village, as one of the panelists had said, and this is our village. And we've got two of them here in our room as well, Maria and Holly, so if you've got questions, you can check in with them also. Thanks, everyone.